Good afternoon, everybody. I'm Dr. Bisi Aluko, and you all kind of have my bio a little bit. So my lovely friend Loretta, whom I've known for many years, has invited me to come and talk about menopause. And it's a passion for me because I discovered that only very few physicians pay enough attention to this kind of, it's not a disease, but it's a stage in our lives that all of us women will get to, and it's actually said to be about 1/3 of our lifetime that we spend in menopause, which is a lot of time, because the remaining 2/3, part of it, we're little kids and we really don't know anything. So if we look at it for our adult life, it's a long time that we spend in menopause. So it became a passion for me because I discovered that so many women come to me and they've kind of gone around so many physicians asking questions, and they're just told, okay, you're getting old, go live with it. That's just the way it's going to be. But I want to say that, no, it shouldn't be like that. Our symptoms can be helped, our symptoms can be taken care of, and there are many options there. Medicine has always been a man's world. So because of that, not too many researches were being done about menopause. So we're going to have 2 classes, and the first class is going to be talking about symptoms. And just like we talked about it, we will take a break and then people can ask questions. So if everyone can note their questions down, just for privacy's sake, we're going to wait till the end of the first class before we take questions, so that if people have personal questions, it's not on recording. So we'll be going through slides and then we'll be talking about it. Okay, so slide 1 just basically talks about what we'll talk about, the definitions, the common symptoms that are related to menopause. So knowing what is caused by menopause and what is not. So basically, this is what happens in menopause. We're aging. Our brain cells are decreasing. We're losing our hair. Our skin is thinning out. And then the fat cells are growing. That's just what happens in majority of women through menopause. We start to gain weight around our waist and our thighs, and then everything else is just, it's going the other way, down south. Okay. Okay, so it's going to be a fun class, so everybody get ready. Okay, so usually when we do it in real life in a classroom, I always emphasize the importance of privacy. Nobody should be judgmental when people ask questions, and that's what I'm asking here. Even though we're going to do it on Zoom, you recognize someone's face, you recognize their voice, please, privacy. And it's an encouraging group where all women, we go through this journey differently. Some people go through it with some symptoms, some people go through it with another symptom. So no judgment about whatever question. No questions is too stupid, no question is too silly, and no question is too hard. I want everybody to be comfortable at the end of it to ask whatever question that you want to ask. Even as a physician, I still ask questions about menopause because a lot needs to be known. If I can answer the question and make people understand it, then that's how you would have made my afternoon. So my job here is to educate women, empower each woman to understand and be informed about menopause and aging, and importantly, understand the choices that are available to take care of themselves through this process. So each woman is unique, like I said, and each person's experience is unique. As we all know, we say it, no 2 fingerprints are the same. And with my little practice, going to be 30 years practicing medicine, barely do I see a woman that has gone through menopause exactly the same way. even siblings don't go through it the same way. Maybe identical twins, but fraternal twins, siblings don't go through menopause exactly the same way. And it's because so many things in our environment, in our life, changes the way that we experience it. So some of the possible goals of attending this class and listening this afternoon is to understand and feel more comfortable with the menopause transition, be well informed about the choices that we need to deal with the health, social, and emotional changes that we go through as menopausal women, and then to also be able to share experiences and realize that we're not going through this all by ourselves. Others too are going through it. And then we can also encourage each other, because that is what we women always do. We encourage each other through pregnancy, through childbirth, through marriages. So it's another way for us to encourage ourselves. So the word menopause is a Greek word. And if we break it down, the men in it means month. The poin means cessation. So literally, the word means the cessation of the month, because it's a monthly period, is a monthly thing. So that is what menopause basically means. That's the root word of the word menopause. So menopause, it's normal. It's a natural event. Just like the way we start our period when we're younger, preteens, teenager, one day is going to come when our period is going to end. And that is because as baby girls in our parents, we are already born with our eggs. And then the eggs, we're born with millions of them. Then they start maturing. And when they start maturing, then they start causing the changes that we'll see in the cycle. So that is how menstruation ends up starting. Then when that has happened, after some time, for some unknown reason, then the egg starts to die out slowly. They no longer are able to produce the hormones, and that is when they cease working. So in menopause, that is what happens. The eggs are now dying off and hormones are no longer being produced. Menopause, the word menopause, we use it when it's exactly 1 year after the last period. So if somebody started their period January 10th of maybe 2019, and they don't get a period until January 20, 2020, then we will say they are in menopause. From January 10 from January 19 of 2019 to January 20, 2020, during that period, they're not yet in menopause. They're still in menopause transition. They're still moving. And that is why some women will come and say, oh, I had my period 4 months ago and I thought I was in menopause. Now it started again. Yeah, they're not yet in menopause. So, and the reason why that is important is for a physician, if after 1 year of not having a period, ladies, if you get a period, make sure your physician check you out. So if you've marked that your first birthday of not having a period and 2 months after you start bleeding, please get to your physician, make sure you get your pap done, make sure you get what we call an endometrial biopsy done. It's very, very important. That's the importance of that 1 year, because after that 1 year, studies have shown that if you start bleeding, there may be something wrong. There may not be, but there may be. So that's important. So once that is confirmed, then you are now said to be in menopause. Average age of natural menopause in North American women is about age 51. So most women who still have their uterus, their ovary, everything intact, usually go into full menopause around age 51. Menopause is the end of a female reproductive phase, and it's an opportunity for us to check our health status and our goals, both health-wise and socially and emotionally and in every way. Before age 40, if somebody's period stops, we call it premature menopause. And there are different reasons why people go into premature menopause. Some people, their ovaries will just quit on them before they get to that age 51. And that is when we call it premature ovarian insufficiency. We don't know why somebody's ovary will just quit that early. But sometimes we know why. Doctors go in, they do some surgery, they tamper with the blood supply, the ovaries get upset and they stop working. Sometimes some people have to, unfortunately, have chemotherapy or radiation for a cancer, and that kills the ovaries, then the ovary stops working. Or some people have cysts and they actually had to have the ovary removed, or cancer and they had to have their ovary removed. But if it happens before age 40, it is called premature menopause. So that also is important, because if somebody stops menstruating at before the age of 40, they need to go on hormone therapy. It's important that they go on hormone therapy. As we go down, we'll see that if somebody reaches natural menopause at 51, the choice will be up to them. But at below age 40 is important, because it's important for the function of their heart, it's important for their bones, it's important for their general health, for them to go into menopause that early. I'm glad that I'm talking to a group of people who are quite religious like me. So the person who made us had a reason why he kept that on till about age 50. So if something happens to it that we don't get to that age, we still need those hormones in us till about that age 50. So that is the importance of that point. Okay, so the perimenopausal phase starts from the early menopause transition and then continues to 1 year after the last menstrual period that we talked about. So we'd say a woman is perimenopausal when we include all of that time when the period is misbehaving until they stop, up to 1 year. So that's called the perimenopause. So women will say, I'm in perimenopause because it's just starting, things are just kind of misbehaving, period here and there. So early perimenopausal time is variable in most women, but most women start going into menopause at about age 40. Menstrual period changes. Some people may have a little bit of hot flushes. The duration of the bleeding may be longer, may be shorter. The cycle may be, somebody who used to have 28-day cycle may now start having 30-day cycle, or may have shorter cycle that is 21 days. So things start changing. Most women start seeing some changes around about age 40, which is the early perimenopause. Then the mid and late perimenopause is usually that last 1 to 4 years before the person goes into full menopause. Same thing, period interval starts to change. For majority of women, the time between one period or the other becomes much longer. Hot flushes are more, night sweats are more, and then finally, slowly, the period then tapers off and quits at one time or the other. So the postmenopausal phase is right after, as we said, 1 year after the period starts is when we now say menopause. And then from that time on, we call it the postmenopausal stage. So for example, my period stops, let's say April 1st this year. Next year, 1 year from there I will be in menopause. And then from then on, I will be said to be post-menopause. So that starts with, we break it into early and late. Early is the first 6 years, and that is usually very turbulent. That is when people have mood swings. That's when people don't have a period. That's when the hot flashes get worse. That's when there's dryness in the vagina. There's problems with urination, frequent bladder infection, and so many things. And truthfully, to go a little out of just the physiology of menopause, that is also when a lot of social things happen in people's life. Your kids become teenagers and they are killing you with attitude. Parents age and you're needing now to care for parents. People go through marital issues. The man is realizing that, oh my, we don't have enough savings for when we are elderly. They're going through their own midlife crisis. So that period of life is usually a difficult time for most women. Then the late menopause is basically the rest of people's life. And for most women, the hot flashes are gone. Mood swings are sort of settled down because either the person is now on medication or things in life have kind of settled. You've kicked the kids out of the house. Parents are settled in some long-term care, or sadly, they may have passed on. So all those kind of things are a little more settled. But that is interestingly when the vaginal and urinary symptoms get worse. And as we get to that, we'll see why those get worse. And things like bone density too get worse towards that late menopause period. Okay, about 1,100 women per day go into menopause in North America. So that tells us that it's a lot of people. We're not alone in this. It's constantly happening every day. 2.7 million women, which is 1 in 6 women, will go into menopause in the next 10 years. So just count as you walk out, 1, 2, 3. The sixth person will be going into menopause within the next 10 years. So this is just statistics to tell us that we are not in the journey alone. There are lots of women out there who are going through the same thing. And just like I said at the beginning, about a third of our lifespan is spent in menopause. So we've got to find a solution. We can't sit back. We need to figure out how to deal with it, because it's a number of years that we don't want to keep having problems and not have the solution to it. In 1872, women who were peri and postmenopausal were considered as mentally ill and to have incurable dementia because of the mood swings that they had. And a doctor thought, oh yeah, I know the solution to all this problem. They just need some purgative treatment, remove them from their homes and just put them into the asylum and shut the door on them until they can fix themselves. So that's how it was, in those days. So it's been a long way. So the first thing that I would like to say is there's no universal menopausal syndrome. These are all different symptoms. Somebody may have 1, 2, 3, or all of this. So these are common classic symptoms that menopausal women have. Changing the menstrual cycle pattern during the perimenopausal stage. What we call vasomotor symptoms, basically it's hot flashes during the day, night sweats at night. Genitourinary syndrome, which basically means dryness in the vagina, itchy vagina, painful intercourse, urinary incontinence, recurrent urinary bladder infection. Those are all into that big group. Then sleep disturbances, people can fall asleep, they can't stay asleep, or they can't fall asleep, different types of sleep disturbances. Other symptoms that people could also have: memory loss, people can't find words for objects, poor concentration, weight gain, we've talked about that, osteoporosis, which is thinning of the bone. The bones become very fragile. Then our appearance and body image changes. We gain more fat around the belly and around the thighs and the butt area. We grow hair where we don't want to on our chin, and we lose the one on the top of our head, unfortunately. It affects our self-esteem. We have the fear of aging and dying. Like I said, our parents, our older siblings, they're passing on. So the reality of life starts to hit us. Career, retirement, do we have enough savings? And all of those kind of things start coming at that time. Sex and sexuality, pain, discomfort with sex, appearances, all those start affecting our sexuality. Then other midlife health concerns, which are not menopause related, but are part of aging and being in midlife, starts to set in. Heart diseases, diabetes, hypertension, cancer, midlife diseases also start to creep in. Feeling of loss and grief, the kids start leaving home, empty nest syndrome, all those start affecting us. Our babies are going, are they okay? That feeling of loss and grief starts to also add on to all our symptoms. Depression, anxiety, mood swings. We joke about the 7 stages of menopause. We're itchy, we're bitchy, we're sweaty, we're sleepy, we're bloated, we forget everything, and we're psycho. Okay. So, hot flashes, I'm burning. It's a recurrent but transient episodes of flushing accompanied by a sensation of warmth to intense heat. It depends. Some people just feel warm. Some people it's very, very intense. It's commonly on the upper part of the body, the neck and the face. People describe it that it just comes and it's like, boom, comes up to my face and people turn red. It's commonly referred to as hot flushes during the day, and then at night we call it night sweats because people wake up from their sleep and they're drenched in this cold sweat. Hot flushes also can sometimes involve the whole body, but like I said, it's commonly neck and face up. It's commoner perimenopausal, like if you remember the earlier slides, it's worse in the early part of menopause, first 2 years of being menopausal and during the perimenopausal stage. It's severe in about 10 to 15% of women. It may stop in about 3 to 6 years, but unfortunately, some women will have it all their life. And it may be more severe in smokers. This is basically what medicine understands about hot flashes, because truthfully, there's still lots of research. No one can still say for sure exactly what happens. All they just know is something in the part of the brain called the hypothalamus that controls our body temperature is almost like something flips in there because there's no more estrogen in the body. And for just those few seconds, the body is not able to regulate its own temperature. Thank God it only happens for a few seconds, otherwise it will be disaster. So basically the core body temperature goes very high because the body just can't keep its own temperature within normal. And because the body's response to very hot inside is for the blood vessels in the hands, on the skin surface to open up so we can lose heat, basically. That's what happens. So the skin blood vessels just become bigger. So then blood can rush into the skin. So we can quickly lose heat, because if we don't lose heat, every organ in the body is going to pack up because it cannot deal with that high temperature. So that's what happens. Then because the blood vessels open up, then the person is red. That's why people will say, oh, my face just turned red. And then for those few seconds, minutes, there is that loss of heat, which is true sweating. Then the person gets cold again because now The temperature is still normal outside, but you're sweating so much, which is why then people get cold again. They grab the jacket and they quickly put it on. So it's hypothalamus just kind of getting out of work for just few seconds to minutes. So that's basically what causes it. But why does that? They still haven't really found out why. So I'm still hot, but it comes in flashes. Okay, so all of this can happen. Yes, weight gain in midlife is related to aging and lifestyle. Many of us think it's actually menopause that makes us to gain weight. No, what happens is not really that menopause, is just the redistribution of the fat. Every human, male, female, gains weight in midlife because all our metabolism goes down. If you look at our male counterpart, they get their bare belly too in midlife. So it's not really that loss of hormone that makes the weight gain, but then it is the loss of hormone that makes us to gain it where we don't really want it to be. Skin. Our skin collagen starts to drop, which is the reason why everything flaps, which is the reason why we thin down. That is due to lack of estrogen. Our skin starts losing that elasticity that makes it to stay firm. Then there is increase in the androgen, because when we start going into menopause, it's only the estrogen and the progesterone that we lose. We don't lose androgen, which is testosterone, because we do have a little bit of men hormone in us. We don't lose that. So because we don't lose that, the amount of that stays where it was before, but the amount of our estrogen drops. So we kind of almost tend to be manly, but of course, it's not like we become as manly as them. So that is why we start balding like them. We start losing hair in the middle, on the top of our hair. We start thinning hair there. It's a male thing. And then we start growing hair on our chin. It's because of that imbalance in our androgen and estrogen. Bone density, we lose bone density. We start losing the surfaces of our teeth, which is why by midlife, then we start having trouble to the extraction, many dentures and all of those. Then there are evidences also that has shown that as we get older, as we get into midlife, the speed at which we do things reduces. The speed at which we can think, at which we can grab things, all of those starts going down. At speed at which we can process information in our brain, they all go down, which leads us to forgetting the names of things. You know, we see this and we're trying to remember the name and we can't. It's like, it's right there. You know, people will be like, it's right there on my tongue, it's on my tongue. But the good thing about it is that verbal memory loss that we have at the early part of menopause, we do get it back. But the reason why we don't realize we get it back is that the natural aging also makes us to lose memory, because a few of the brain cells start to die. So by the time we reverse from the memory loss from menopause, sadly, the aging memory loss again catches up a little bit. So sleep and mood disorder, both can be very interrelated. If we're not sleeping well, due to hot flashes, due to other stresses, that can affect our mood. And other things can cause our poor sleep because of the bigger, trunker weight gain, sleep apnea develops. So it's important when we are not sleeping well, we need to be checked for sleep apnea, because the solution may just be a CPAP machine and our sleep may all be fixed up back. Menopausal women are 3 times more likely to have sleep apnea. So like I said, it's important for us to get our sleep study done through our physician. Other things, dry eyes, because we're losing collagen, so our eyes get dry. Then there's increased rate of developing things like cataract. Then hearing loss also, we start losing our hearing, which is also related to decreased collagen. So the eardrums are not moving the way they should move. So when voices and sound come to hit the eardrum, it doesn't vibrate well, so it doesn't transfer the information to the brain well. So vaginal dryness, that's another very, very common symptom of menopause. We call it a big name, genitourinary syndrome of menopause. It increases with age. If you remember from the beginning of the slide, I said in postmenopause, in late postmenopause, this is usually a bigger problem than even in the early menopause. It can be caused, it is caused by reduced vaginal secretion because the estrogen thins down the vaginal wall. So there's a decreased secretion, there's decreased blood flow, there's thinning, there's changes in the normal flora that is in the vagina, because yes, we do have healthy bacteria in our vagina, it's normal. So this healthy bacteria, they're no longer there, so inflammation occurs because they're kind of the ones that cause everything to be in balance, so that the abnormal bacteria don't overgrow. So when the healthy ones are no longer there because there is no moisture for them to live and survive and reproduce, then the unhealthy ones grow and they cause inflammation. Vaginal dryness could present as irritation, itching, burning, and I say outside of sexual activity, there could be burning. And then during sexual intercourse, there's decreased lubrication and pain. There's also low libido and decreased sexual satisfaction. And the low libido is not just from the hormonal changes, it's also from long term. When people are not enjoying sex, when it's always painful, there's going to be a feedback to the brain that I don't want this activity. So it leads to a problem. And then from there, it becomes a family problem, because then there's spousal issues with that, with partners. Then there is also decreased sexual satisfaction. People do not have as good as an orgasm as they used to have. So this also inversely will cause them not to be interested. These are all caused by the low estrogen in the vaginal tissue. Okay, so basically this is what people will present with. No interest in sex, it hurts when they try, there is really little or no orgasm, and worst of all, they're having incontinence, they're peeing their pants. So this is all compounded in the genitourinary syndrome, which has partly the vaginal symptoms and then the urinary symptoms. We've talked mostly about the vaginal symptoms. The urinary symptoms could be incontinence, urgency, frequency, recurrent bladder infection. Some people may have bleeding. I've examined women that you will actually see little cuts in the vulva area, which results into bleeding. So this is kind of like same thing we've talked about: loss of elasticity, thinning, paleness, pain. Some people, when they're passing stool, their vagina is actually tearing from being too thin. So I always say it's when I'm teaching menopause class, it's not only about sex. It's also about just being comfortable down there. So the vagina becomes shorter also in menopause, and then it's narrower. The labia, the lips of the vulva, it loses fat, so it's thinner. Sometimes I've seen women where their two lips are stuck together from menopause. So it can be quite severe, and many women are not comfortable going to talk to the doctor about this. Please do. It happens and it can be fixed. So there's tissue loss from the labia. Some people don't even like what they look like there because everything is so thin, everything it's just not looking the way it should. There is treatment for all of those. As I said, the clitoris sometimes is fused, which is the reason why people cannot go cannot have orgasm, because now the inner lip is fused over the clitoris, so everything is all stuck together there. There's increased pH, which basically means that the vagina is supposed to be more of an acid, but it's in menopause, it becomes more of an alkaline, and the importance of that is the good bacteria cannot live in that environment. So people start having smell they don't like. We always talk about something called bacterial vaginosis, which has this fishy smell. It's not a big infection. It's something that can be treated, but it's very common in postmenopausal women because of the abnormal pH, which can all affect people's self-esteem because they can smell themselves. I always joke, nobody else is smelling you, because people come in and they come see me and they're like, can everybody smell it? No, nobody else can smell it, only you can. But it actually does affect people quite a bit because nobody likes that kind of fishy smell in them. Yeah. So these are the joys of menopause. So this is a happy vagina, and that is a menopausal unhappy vagina because it's dry and it's not really happy with itself. So management, I'm just going to, this is kind of like a summary because the second class is going to we're going to talk in more details about treatment. So I usually, because I do this over a few weeks normally, so this is a summary, because people always say I give them all the bad news and then I send them home for weeks. But so that's why I kind of did this summary. So basically, for any symptoms, we're midlife, when we're in menopause, important: exercise, 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 aerobic exercise, strengthening, stretching, relaxation, whatever kind of exercise you like to do, it's very important. Eating healthy, high fiber diet, fruits, vegetables, keeping our weight within normal as much as we can, alcohol in moderation, quitting smoking. Those are all important general things that we can do. For the hot flashes, there are different treatments for that. Estrogen only, estrogen and progesterone, and so many non-hormonal things. We'll discuss it in the next class. Mood swings, there are antidepressants, anti-anxieties out there that can be prescribed. Sleep hygiene, and other things we'll talk about in the next class. And then for the vagina and the bladder things, bladder concerns, these are all the different things that can be used. Some are off-label, some are not. So that's for that. So that's summary. Okay, so this is just one of the laser machines that we will talk about more in details when we get into the next class. Okay, so that's what second class will be about. It's mostly about treatment of all the symptoms that we've talked about, and that's it for slide 1.